I hope and pray that people really understand the crisis that we are in the hospitals in Central Ohio. This is not the standard that we deliver healthcare compared to especially what it was before this pandemic.
More COVID-19 patients are being hospitalized by the day. Good evening, everyone. I'm Colleen Marshall. Carrie is off tonight. Throughout the state, there are more than 6,100 people in the hospital right now sick with the virus. That is a new record and one that's been broken each day for the past week. NBC4's Eric Halperin is outside Riverside Hospital tonight. So, Eric, Central Ohio hospitals not being spared by this current rise, and it sounds like it's getting to be a bigger problem.
Colleen, here at Ohio Health, they have more COVID-19 hospitalized patients right now than at any point during the pandemic. A spokesperson tells me over at Mount Carmel, they also do. And the Ohio State Wexner University Medical Center is getting close. Statewide COVID-19 hospitalizations are on the way up, breaking records by the day. This is happening in Central Ohio, too.
Right now at Ohio State, we're within about 10 patients of our highest active COVID census that we've had at any time during the pandemic.
Dr. Andrew Thomas oversees one of the state's COVID-19 response zones. He's also the chief clinical officer at the Ohio State University Wexner Medical Center. According to the Wexner Medical Center, there are 677 COVID-19 patients across Central Ohio's 3 adult hospital systems. A hospital spokesperson says that's a 32.5% increase in the last week.
While we're at an all-time high 2 years into this pandemic, we're still seeing these record numbers, and it just doesn't have to be that way. So I think our hospital workers they're frustrated.
President and CEO of the Central Ohio Hospital Council, Jeff Klingler, says this is not just a COVID issue, but a community issue because of how busy hospitals are. According to the council, as of Monday morning, there were 150 patients, COVID and non-COVID, in Franklin County emergency departments waiting to be admitted to 9 hospital beds.
It is impacting the ability of hospitals to care for all patients in the community.
And if we go up another 25, 30% on our COVID patients here in Central Ohio, which is kind of where you would track if you looked at where Northeast Ohio is, I mean, it's going to be a really, really difficult month of January.
And doctors in the Central Ohio Hospital Council say they do expect hospitalizations to keep going up for at least the next couple weeks. Local for you in Columbus, I'm Eric Halperin, NBC4.
Thanks for that update, Eric.